I don't have to tell anyone in this room, this conversation could not be more urgent. There's a hunger out there for serious change in healthcare. To be sure, we've made some important steps over the last few months. Congress has already acted this year to strengthen healthcare coverage for children of low-income workers and for workers who have lost their jobs during this recession, and made an investment in technology to get healthcare costs down. The House passed the Breast Cancer Patient Protection Act last year after 12 years in the wilderness, and I hope that we will see its protections in any final reform. But the crisis we face will take more. For those with coverage, surging healthcare costs are eating up more and more of the family budget. Insurance premiums have more than doubled over the last decade, from $6,000 to $13,000 a year, while wages have barely been seen to rise. Today, 75 cents of every healthcare dollar is spent on chronic diseases like diabetes, heart disease, and cancer, many of which could be prevented or better managed to avoid expensive complications. That means improving quality, rewarding efficient, high-quality, patient-centered care. That means investing in healthcare professions that are experiencing dire personnel shortages: primary care doctors, nurses, geriatricians, and other specialists. Before the recession, there were 46 million people with no health coverage, 326,000 in Connecticut. Now the chaos in our economy is causing an estimated 14,000 people in our country to lose coverage every day. And that means bringing some basic fairness and some common sense to healthcare, and just looking at how we end cherry picking while the healthiest people while leaving those with expensive medical conditions behind. Let's make sure that health insurance is comprehensive enough to actually cover people's medical needs when they get sick. I had the pleasure of introducing something called the Informed Consumer Choices in Healthcare Act this past Thursday. It is about giving people the tools to make informed choices about their coverage, to make sure that it will truly provide adequate protection in case they get sick. It's about promoting transparency in coverage and providing data to healthcare providers and consumers. In the end, though, only comprehensive change, dealing with costs, coverage, and quality, will truly get us back on the right path. Some will argue that now is not the time for change, that we cannot afford healthcare reform today, that we have too much to tackle with the economy in a free fall. In fact, in my view, it is precisely the reason to act. Only with healthcare